So welcome everyone. I am Professor Andrea Rother. I'm head of the Environmental Health Division at the University of Cape Town in South Africa. And I welcome you all today to our pesticide discussion. If you've just joined us, please do take a moment to introduce yourself in the chat room. It's a good way for all of us to learn who you are, who's joining us today. So for those of you who are new, welcome. This is a discussion forum that we hold regularly, which is funded through the chemicals, funded through Sweden, through the chemicals agency, ChemE. We also have Tatum in the background. There is from UCT providing technical support. So if you need assistance, there is a WhatsApp group. So we encourage you to please go to the WhatsApp group. And do continue to introduce yourself in the chat. So we hold this discussion forum with the intention of bringing together representatives from different regions, different stakeholder groups to really foster a mutually supporting consortium of stakeholders to discuss various issues related to pesticides, particularly to build the capacity of regulators and researchers and NGOs in low and middle income countries, and to discuss emerging issues related to pesticide use. We really hope to achieve this by learning from each other, sharing information and data, identifying gaps, and problem solving collectively. And mostly to prevent pesticide poisonings, chronic effects, and environmental contamination with a view to a toxic-free future for the next generation. This is not a webinar, it's a discussion. It's really a peer-to-peer learning process. We're nonpartisan, which means we may not agree with each other's viewpoints, but we will respect each other. When you do comment in the chat, when we're into the discussion, do continue to put your country in. It really helps the presenter and us to know where you're from. We ask you to please respond to the questions that will be posted, but also to respond to each other's posts. Shortly, I will introduce today's speaker, and then we will have 3 questions that will have a half-an-hour discussion each. There will be poll questions and Mentimeter, and we encourage you to respond to that. So today's discussion is going to be on pesticides and suicides and looking specifically at implementing policy change related to pesticide and suicides. Suicide and self-harm can be a sensitive topic, and we acknowledge that some of you might be impacted by the content of today's discussion. We encourage you then to reach out to many professional resources that are available. So it gives me great pleasure to introduce today's presenter, Asati, sorry, I've lost my notes. Asa Sethi is a project and policy officer for the Center for Pesticide Suicide Prevention. You're most welcome, Asata, and we're very grateful to have you today. She has been working with various regional governments in India to create credible research evidence regarding pesticide suicides and influence policy change for elimination of highly hazardous pesticides. Her research focuses on identifying specific compounds responsible for pesticide suicide mortality in India and working with government stakeholders in public health and agriculture to create pathways for their elimination. Asa, you're most welcome, and I hand over the microphone to you.
Thank you so much, Andrea, for the introduction. And welcome, everyone. I've been reading the chat, and I feel people have a lot of experience, and I see very, very distinguished attendees today. So I hope I'm able to impart some good knowledge and also learn from your viewpoint, as this is a discussion. So I'll just start by introducing myself. As Andrea said, I work with the Center for Pesticide Suicide Prevention, and we started working in India in 2019 while being in partnership with one of the regional governments in India. And what we first started out to do is to really explain the problem to officials within India, because suicides and pesticides are something that are not easily correlated when people do not know about the problem. So I'll just introduce the problem. Since pesticides have been used in Indian agriculture, we have seen 14 million deaths since the Green Revolution, and 150,000 deaths every year. This is a global number, happen due to pesticide suicides. And for every one death, there are 20 attempts. So the problem is that pesticides are very easily accessible and lying around, because of which people tend to use these as means of suicide. And this can be somehow also compared to availability of guns, let's say. So the chances of you using it for self-harm drastically increases because of easy access. Most of these cases occur in low and middle income countries, because these are the countries where highly hazardous pesticides are still freely available. They're not regulated or banned, while many countries in the developed world have been able to phase these out. Can I have the next slide? So while we talk about the global problem in LMICs, I'll be using India as my case study, because I have been working in India and I know exactly what is the situation in India. There are 27,000 pesticide poisoning deaths by suicide in India, and this is from 2021 data. And these deaths have been increasing every year. So last year it was 26,000, and then before that, every year there is almost a 10% increase in deaths. While this is something which is very, very concerning, we also have accidental poisoning as a huge problem in India. Occupational hazard is a huge problem in India, because farmers spray these pesticides. It's a tropical climate, and they are not able to use protective equipment, because of which there is a lot of accidental poisoning cases that happen. And state governments have been trying to combat it, but it's I'm sorry, I think someone in the chat says they are not able to see the presentation. Yeah, I'll just continue. I think we can see what happens there.
We
Yeah.
can see it. Go
Okay.
ahead. Yeah, we can see it. Thank you.
Sorry. So like I said, these numbers which I have put here are from the official data. However, we have a lot of researchers on field and also published researchers which show that this is underreported, because most of these self-poisoning deaths and even occupational poisoning deaths are somehow not always verified. And specifically in case of poisoning with suicides, because of suicide being such a taboo in India, and also it becoming very difficult for every time the data to be recorded properly by the police, we assume that the number would easily be double of what it is. So close to 50,000 deaths by suicide is what we peg the number to be. Can we play the video?
We're just waiting for the video to come on. If you just give us a moment.
Anushka is from the north central province of Sri Lanka. He's a survivor of pesticides poisoning. When he found out that his girlfriend had denied their relationship to her parents, he felt embarrassed, shamed, and a loss of face with his family. He believed that he had no other way of expressing these feelings, so he drank a bottle of pesticide. He admits that it was an impulsive act and he didn't think of the consequence, but at that time, he thought this was his only option. Luckily for him, the pesticide he drank was not a highly toxic one. Because of this, Danushka has been able to get through his crisis and go on with his life.
So the reason I decided to play this video is because this is something that we have collected from our fieldwork in Sri Lanka, where we spoke to survivors, and it is something which CPSP has worked on over a decade, where we have realized that most of these acts of self-harm are actually spontaneous and not thought through. Therefore, the theory of them being easily accessible is what leads to suicide is something that has stood the test of time and is also verifiable by research. Next slide, please. And given the fact that availability is what is leading to these impulsive deaths and also self-harm, the most effective way to prevent the deaths from pesticides pesticide poisoning is to ban these pesticides or remove accessibility to them. And to do that, even the World Health Organization has come up with in their preventing suicide document, they have stated that the most effective, cost effective way to reduce suicide mortality is by banning these pesticides. Now, of course, this doesn't mean that we do not focus on mental health and we do not focus on other ways of making sure that suicide prevention projects happen in the community. But for reducing mortality, banning pesticides is something that is very, very credible and we should be doing it. So most also what we found out in our research is that most people who survive acts of self-harm rarely go on to try again and attempt suicide by other means, which also means that in high income countries where these pesticides are banned and you see poisoning deaths, these are poisoning deaths are very, very low in number. And if there are any poisoning attempts, people actually survive those because such poisons are not freely available. Next slide. So since we're talking about policy change today and what we do in India with regards to that, I have made a brief timeline of major policy decisions which have been implemented in India over the last decade. So 2011, the Supreme Court banned endosulfan throughout the country. And endosulfan, the story behind that is that the southernmost state of India, which is called Kerala, had a district had a major incident with endosulfan where lots of people died because of aerial spraying of this highly hazardous chemical. And at the same time, we also observed reproductive defects, genetic defects within the population, which continue till this date because of major policy change. The major policy change happened only because the citizens revolted and there were grassroots level movements against endosulfan. And post this, there in 2013, because of a tragedy in the Indian state of Bihar, where 23 children died due to monocrotophos poisoning, the government was then forced to set up a committee called the Anupam Verma Committee, which looked at the pesticides which are used in the country and how to safely use them and what pesticides should be phased out. The committee recommended that 66 pesticides should be placed under the scanner, reviewed and systematically phased out at any point of time. However, because of generally pesticide lobbies and because of agricultural dependence on pesticides, it took almost 5 years for the government to ban 18 pesticides. And after these pesticides were banned, these were phased out over 2 years by 2020. And out of 66 right now, we only have 18 pesticides actually banned. In 2020, the government released a draft proposal to ban 27 pesticides, where they asked for suggestions from activists and experts in the field to tell them if they should be banning these pesticides, and also from pesticide manufacturers. Our organization, the Center for Pesticide Suicide Prevention, we were a part of this suggestion committee. We did give our uh, opinions about it, and we also presented our research to the government, after which another committee was set up. And however, the ban hasn't actually gone through yet. We are really hoping that maybe within this year or early next year, we see that at least some of these 27 pesticides are also banned. Next slide. So a background about the draft ban is that 12 pesticides proposed for the bans are actually from the class 1 and class 2 of WHO classification, which are acutely toxic to humans. And the major ones are acephate, carbofuran, monocrotophos, dimethylate, and chlorpyrifos out of the 27, which are majorly responsible for self-poisoning deaths in India. Next slide. So when we talk about banning, I first want to also focus on the fact that it's very imperative to consider who are the stakeholders when you work on this. So identification of stakeholders becomes very important. So first, of course, is environmentalists here, because of the fact that environmental effects, for example, uh, residues in water and soil and in food, is something that there are organizations in India which are working on, and they have also been working with us and helping us to make our case to the governments to ban these highly hazardous pesticides. The second is farmers, but I'll be talking about them in detail. So I'll just skip that and move to public health professionals. Public health professionals in India have also been useful in terms of conveying the message to the government, because doctors have seen a lot of cases of deaths And this is because there are no antidotes for many of the highly hazardous pesticides. For example, paraquat has no antidote. And they have also seen occupational deaths happening every year. And every year during spraying season, when the crops are being sowed, and then pesticide spraying is being done on a large scale, there's a lot of deaths that doctors see, and they have been protesting and telling the government that these pesticides either need to be phased out or something needs to be done to stop these deaths from happening, specifically in the eastern parts of India. The next stakeholder is, of course, traders, because when we come to pesticides, we have to look at the economics of it. Trading in terms of food and trading in terms of pesticides, both is a big industry, and they are important stakeholders here. Pesticide manufacturers are a very, very big industry, and it's a 4.5 billion US dollar industry in India. And if you can just imagine the scale of money that the pesticide manufacturing lobby has, and at the same time, biopesticides only comprise of 70 million US dollars in the market. So we know that we want to close this gap between and have biopesticides really take over the highly hazardous pesticides. But as you can see, the difference, it definitely is an uphill task. While we are trying to work with pesticide manufacturers, most of them are also international organizations which produce in countries where these pesticides are actually not allowed and are banned, but they export to LMICs, specifically India, Sri Lanka, Bangladesh, and they are able to sell in these countries, which is also a human rights violation of sorts. So we have also been pushing for these companies to look at it and ethically not export products here. Uh, and while we speak about the pesticide lobby, we also have small manufacturers of pesticide in India. So they are worried about unemployment, and so is the government, and because of which these form to be the most important stakeholders here. Next slide. So when I speak about farmers, generally here the challenges of food security and of farmer livelihoods. Farmers are okay with banning pesticides. So in our stakeholder meetings with farmers, which we have done in different regions of India, farmers feel that pesticide bans will not be a problem for them, but they do need substitutes and they need government hand holding while the transition period is happening, because any of the other pesticides will prove to be more expensive to use, and also farmers don't know how to use it and what quantity to use the newer pesticides. So that's one important aspect where we need to consider what will the local community think about banning pesticides, because if there is no buy-in from the communities, it's very, very difficult to actually implement some sort of change. Food security, of course, is a huge challenge, because the major problem which we have encountered when we speak about pesticide ban is that people are worried that this will lead to a dip in food production. Next slide. However, CPSP has found that there are sustainable methods which are already being used in India and across the world, and these have been very, very effective all across the world. So we know that there will be no impact on food production if pesticides are removed, because we are not talking about removing all pesticides. What we are saying is the highly hazardous ones, specifically WHO class 1 and class 2 pesticides, need to be removed. The second problem is of maximum residue limits, which food samples in India have been regularly found to exceed MRLs. And this is a public health hazard. And why I bring it up in food security is because food security is not only about quantity, but also the quality of food that is served to the population. And a lot of people are unaware of the fact that many Indian food products are rejected by exports due to exceedances of MRLs, actually come back to our domestic market and are sold to us, and we do not even know that we are actually eating food which is rejected by other developed countries. Next slide. So to make our point in food security and show that banning of pesticides doesn't lead to decrease in food production, we did a study in Kerala state, which I spoke about, the state which had the endosulfan problem. In 2011, along with endosulfan, that state also banned 14 other pesticides. And we looked at the major crops of the state and saw if there was any fall in agriculture produce which could specifically be traced back to pesticides, and we found that none of that is happening in the state. For example, these crops have either stayed stable or have increased in overall aggregate production, And if there has been any sort of dip, which can we please move to the next slide? If there has been any sort of dip like we see in cashew here, that's because this is pre 2011. So we can clearly see that either the food production has increased or it has stayed the same. And if it has fallen, it cannot be attributed to pesticides at all. With that, we also published this paper in the global, BMC Journal for Agriculture and Food Security. And people are free to go and read that paper. I can also link it here later. And what we found is that the government was able to control usage of pesticides very well because of banning these pesticides. And at the same time, agricultural productivity wasn't affected at all. Next slide. So the other barriers that also have come up is, first is public health data is not available at state levels and even at the central level, where we know specific pesticide compounds which are leading to self-harm and which are leading to suicides. We know that there are the number of deaths that are happening from pesticides are maybe 27,000, but we do not know which compounds are leading to these deaths. There are no specific SOPs for data collection even at the hospital level, and the doctors are not trained to collect data that way, because if we know the specific compounds, our case becomes very, very strong in banning these HHPs. Second is agricultural testing of soil, water, and food products is an important source of data that we need to have so that we can show the fact that these pesticides are leaving residues which are harmful. Agricultural data is collected, however, it's again not up to the mark. Third is manufacturers lobby. Again, manufacturer lobbies need to be taken into confidence, because without them, we'll not be able to achieve any substantial policy change. At the same time here, I would also like to add consumer awareness is a big barrier here. And I can't speak about that in detail because CPSP doesn't have it in its mandate and there are no movements in India. But I anticipate that if there is a strong grassroots level movement like Kerala had in 2011, we will be able to make some change there. But for that, we need to sensitize the citizens. Next slide. So I think Andrea can announce the question.
Thanks very much, Asta, for giving us a lot of background, really very succinctly. And I'm sure there are many questions and comments that people can post in the chat, but we're going to move now to the first question. What are the main barriers faced by governments in low and middle income countries when it comes to implementing pesticide policy to reduce pesticide suicides? And I recognize that some of you do not work with governments. You may not even be based in low and middle income countries. So you can make comments based on your experience, or you can ask questions. We'll move into the chat room. Do remember to put in your country when you make a comment or your organization. So I'll see you in the chat room. There will be poll questions as well, which we'll announce. And Asta, you're welcome to stay, keep your mic open or turn your mic on when you want and respond to comments that you see in the chat. Everyone else will be typing, but you don't need to type.
Sure.
Thanks.
Yeah, I see in the chat room that someone has said competency and lack of priority. And these are, of course, very, very important barriers, because lack of priority, like I said, if we have citizens or if we have that kind of awareness among consumers that these things are happening and the government is not giving it priority, then we might see some change, because these are not considered to be, specifically, I'm speaking about in the Indian context, the vote giving or the vote collecting issues. So governments are generally focused on other priorities such as infrastructure, which is easily visible, as opposed to pesticide residues, which really no one would know about, or the mainstream public wouldn't know about. There is lack of data on active ingredients. Definitely, that I mentioned that in my data barriers. It's very, very important that governments, specifically hospitals, start collecting this data, and it will really help our case.
While you continue responding to the first question, there is a poll that has been posted. The link is in the chat. If you just click on it, it'll take you to menti.com. And then you can indicate what is the most important factor in implementing pesticide policy change, and do put your country or organization in your response. Thank you.
Then policing mechanisms at ports of entry are not very effective. That is actually again an issue that we face in India, because if there are regional bans, then we need to have a country level ban to actually first see a full change in pesticide usage. But at the same time, if the pesticides are available specifically in neighboring countries, they are very easily poached into, very easily smuggled into India. And since CPSP works in Nepal and Sri Lanka and Bangladesh as well, when the pesticides are not banned in India, it's again a problem, because Nepal and Sri Lanka are very close to India, and or Bangladesh is very close to India, and these pesticides can be smuggled. So actually, all countries together need to ban it properly for it to really show results. Data, of course, seems to be a very popular answer, and I agree, we really need good data in LMICs to be able to make sure that these pesticides are banned. And the misconception that lack of pesticides will lead to hunger in the country because there won't be enough food is, again, it's a myth. It's a myth that has been created maybe by pesticide lobbies themselves, and it is completely false and has been disbanded by the FAO and the WHO on various occasions. However, policymakers are still burdened by it.
I'm not sure if you can see the poll responses as well. So you're also welcome to have a look at those.
Okay.
And respond if you'd like. Just a reminder, if you want to respond to the poll, you can click on the link that was posted in the chat, or you can always go to menti.com and put in the code that you can see at the top of the screen.
So what is the most important factor in implementing pesticide policy change? I see the poll responses are also about data. Some of them are about government priorities and adequate resources, which is again a challenge in LMICs, because we want to make sure that this policy is enforced, but at the same time, there is not enough resources to enforce it. And we also do not want to punish farmers who are anyway struggling with livelihoods, and we do not want to make it a very punitive policy at the same time. So we need to make sure that there is buy-in from communities, and retailers also understand their responsibility that they should not be selling these pesticides. The regulation then becomes something that we need to do as organizations working in the country. Lack of research data, definitely poor scientific temper of policymakers. I have seen that in my own experience that policymakers do not understand why they should be banned, and it's said that farmers should use them correctly. So the only reason that there is any environmental problem or there are suicide deaths specifically in our case is because farmers are being reckless with pesticides, but which is again a myth, because we are not talking about farmers, we are talking about 70% of a population which is engaged in agriculture, which is semi-rural or completely rural, and therefore this is again a myth that only farmers are consuming pesticides or only farmers are dying by it. It is the entire rural community that suffers. It's very important to create awareness among pesticide users and the public. Definitely, I agree with that. And even though our center is not working on that directly, I feel like if other organizations come in and start working on that, that will be something very, very useful. And we might also venture into it in the near future. Pressure on the government, particularly from the retail produce sector. Yes, that's again a thing. Governments are scared that they might lose popular support if they decide to ban pesticides, and farmers decide to maybe oppose the fact that governments are doing it. So it's very important that farmers, farming communities, and in general the rural communities understand that these pesticides are really, really dangerous and they need to be banned. There need to be suitable and cost effective alternatives. Yes, definitely. I think in the next few slides I'll also be talking about cost effectiveness of banning pesticides. And while working with various state governments in India, we have spoken about it in detail and also explored cost effective alternatives with them. In India, there are also a lot of zero budget natural farming and natural farming policies in place. We have our indigenous knowledge also to use. However, we need to also push for biopesticides and safer pesticides. So that needs to be done, and the government needs to start giving some sort of subsidies, probably instead of giving subsidies only to the highly hazardous pesticides that currently happen in India.
Thanks. I think we're going to move on to the next poll question. So we're asking you to rank in order of relevance the following for banning highly hazardous pesticides. So strengthening data systems, publishing research, consumer awareness, media coverage, activism, and field experiments. In your opinion, what do you think is the order of relevance that you think is the most important for banning highly hazardous pesticides in your country or the countries that you work in? Again, you can click on the Menti link, which is in the chat, and you can continue responding to question 1. And thanks, there's quite a lively discussion going on at the moment.
While the poll is being answered, I see an interesting point here which says conflict of interest, and many of the officials in the ministry are responsible for regulating pesticides are also into pesticide commercial businesses from Uganda. And I think I agree with this as well. There are a lot of conflict of interest because pesticide in India specifically, is such a lucrative business, and farmers themselves and specific people working in agriculture ministries also have pesticide shops, or they are farmers themselves, so they also do not really have any stake in this, and they want pesticides to continue.
Asta, I don't know if you want to comment on what you're seeing in the poll now. And there may be some factors that people thought weren't listed in the poll. You could always put that in the chat if you feel that there was something that was actually more important than what was listed. These are just suggestions. But please go ahead and comment on the poll if you like.
Yes. So the first is strengthening data systems, and I think I completely agree with that. That would be my answer as well, because data is also important for the governments to realize the problem and put money into it or allocate resources to it. And if data is missing, for example, like I said, suicide numbers are underreported, and therefore suicide prevention policies are not given that much importance because we do not know the actual scale of the problem. At the same time, hospitals don't have specific compound wise data, so they again don't know how to identify those pesticides which are the major culprits and then ban them. So data systems, if they are strengthened, of course we'll have a major part of the problem we'll be able to solve. I think I can't see the slide anymore.
Tatum, we've lost the slides. Thank you.
Second one was consumer awareness. So again, consumer awareness is something that we need more organizations to work on. And with that, actually, media coverage is also very important, I feel, because in 2020, when I spoke about the 27 pesticide draft ban, the media didn't cover it enough. The media hardly gave any importance to that important draft document that had come out. And even though we are not a media organization, but we reached out to certain media portals and said, would you want to work on it? And really none of them found it very interesting. At the same time, I think COVID also had grabbed all headlines, and there was really no space to talk about this draft. So publishing research and field experiments are very, very important to create credibility. But however, these will not work in consumer awareness, but they will definitely help policymakers to take good decisions where we can prove to them that agriculture production won't be affected, or uh, these are the number of deaths that are happening in the country because of this. So this is a problem that they should wake up and look at. So definitely publishing research and field experiments sort of go hand in hand there. Activism and advocacy is something that I personally feel is very important, and we do a lot of advocacy. But I have also seen that governments tend to have some sort of uh, love-hate relationship with activist organizations, and there is also there is a mistrust, or there's sort of enmity that is between governments and activists, because they feel like activists are always blaming them. So we have tried to be an organization that works directly with governments and tells them that we help them better their policies, instead of going against it in public and speaking out about how the government is not doing enough. Because I truly believe that the government is doing certain things, but they are also not able to implement it, because the challenge of such a large country, such a huge population, is also something that they're not able to completely tackle at the same time. So activism, I would say, is important, but needs to be done with a politically correct form, I feel. So that's my opinion on that.
Thanks. We've really had a very good first question discussion. That I think we should now move on to the second question. Thank you.
Yes,
so you can, yeah, go ahead.
Yeah. So the second thing that I wanted to discuss is, why is it's such a why is it such a challenge to ban pesticides in India? Because of course it's the size of the country is huge, the population is huge, and like I said, almost 60% of our population is dependent on agriculture, so or allied activities. So it becomes a very, very politically sensitive topic as well. The federal structure of the country has led to a complicated pesticide policy where banning of pesticides can only be done by the central government. However, agriculture is something that states regulate themselves. So this is a conflict which has happened on various occasions where states are not sure what kind of powers they have, and the center doesn't know if they can let states ban pesticides. And owing to this, we started working with state governments to circumvent center inaction, because the center is not at the grassroots and the center is not really able to understand what state level challenges are. So despite their best intentions, I think sometimes they miss those grassroots challenges. At the same time, the policy stops states from taking corrective action because pesticide lobbies drag them to court and say that this is unconstitutional and illegal for them to ban. So states can only ban pesticides for 3 months at a stretch, and then they need to review it again and they can ban it again if they feel it's something they need to do, but they can only ban it for 3 months at one time. And this, of course, severely limits the powers of the states. However, despite this, states have been able to find ways to circumvent the center power over them, and they have been able to ban pesticides in certain cases by invoking their health acts and saying this pesticide is hazardous, this pesticide is leading to suicide, and they have been able to fight against pesticide manufacturers in court as well. But that requires a huge amount of political and bureaucratic will. So next slide. So here I say that this is a combination of research activism and consumer awareness. If we are able to raise these points, then states will be able to ban pesticides on their own and not have to depend on the center. There is occupational hazard, there is toxicological findings, and there is residues in food. So what CPSP actually has been trying to do is work across these three parameters, work with states and tell them that these are the kind of occupational deaths that are happening in the state. And also the fact that the WHO and the United Nations have said that we should not be using HHPs in warm tropical climates. Secondly, farm mechanization levels in India are very, very low, less than 45%, as opposed to, let's say, the United States of America, where the farm mechanization levels are 90% or 95%. Therefore, farmers are directly exposed to these chemicals, which is very, very harmful. And in the states of Punjab in India, Punjab and Haryana, which are majorly agriculturally intensive, we see cancer levels are extremely high, and there are certain districts which are cancer ridden where there is one cancer patient in every house, and which can directly be traced to the overuse of pesticides in those villages. Toxicological findings, of course, show that pesticides lead to neurodegenerative disorders, reproductive disorders, and respiratory disorders. And farmers who use pesticides complain of these problems, especially during the spraying season, that they feel dizzy, or there is nausea, or there is blurry vision. However, they do not have any choice but to use these chemicals because they feel it is very important for them. These toxicological effects are also exacerbated by the malnutrition in the population, and generally rural communities in India are struggling with problems like anemia and malnutrition, and we have this as a problem also. Residues in food, again, I think is a major human rights issue, because if these pesticide residue laden food is not fit for consumption in other countries, then how is it fit for consumption in India, and why our local communities are consuming this food? So this is a question that needs to be posed to the government, and we need to make sure that this kind of divide doesn't happen again. Next slide. So on the basis of these 3 points of occupational hazard, of toxicological findings, and of pesticide residues, we reached out to various states. So currently CPSP works in Maharashtra, Kerala, and Tamil Nadu. We have also now started speaking to certain stakeholders in Odisha, and we are trying to also work in Punjab. These are the states of India. And all of these states at some point have taken action against pesticides. So Punjab bans pesticides every year during sowing season since 2018. They have been doing that. So like I mentioned, they can only do it for 3 months at a time. But every year during 2018, they ban these pesticides for 3 months at a time. And they have a huge community buy-in because they have cancer problem, they have a problem of export rejects, and farmers have faced problems with pesticides. So the community also acts in not letting these pesticides be used, and the state has some amount of success that they have found. However, this is not this is only a stopgap solution. This is not a permanent sustainable solution. So the center needs to act and ban these pesticides once and for all. Many of these pesticides are also in the 27 draft ban that I spoke about in the very first slide. Maharashtra government, we work with very closely. With this government, we have also collected specific compound-wise data and presented it to the government. And we have shown them that class 1 and class 2 pesticides are the ones that are leading to the maximum number of deaths. This data, of course, is not completely foolproof because the only data we have is from toxicological laboratories. So there is a lot of data missing, but we feel like if the state ramps up its data systems, we'll have more knowledge. The state also has the maximum number of pesticide suicides in the country, and on certain occasions they have tried to ban pesticides. They have written to the central government. So these are the pesticides which are listed, the compounds that the state has banned in 2017 and 2019 on 2 separate occasions for 3 months each. However, they were not able to sustain the bans. Kerala was able to permanently ban pesticides in 2011 through a specific dedicated policy that they launched called the Green Farming Policy. I'll speak about that in one of the later slides in detail. Tamil Nadu we are working very closely with Tamil Nadu government. We helped them draft a bill on the pesticide regulation policy because Tamil Nadu has the second highest number of pesticide suicides in the country. And the state is, of course, very worried about the number of suicides that have been rising, specifically as also during the COVID time. And therefore, they are willing to ban pesticides. In Odisha, we found that doctors were striking against paraquat because it has no antidote. And Odisha is an eastern state of India. It's a coastal state. It is also one of the poorest states in India. And because of this doctor ban, we reached out to certain journalists and activists who are working, doctor strike, sorry. We reached out to certain journalists and activists who are working in the state to see if we can do something about it. The state government has taken cognizance of it, and we hope we'll be able to work with Odisha state and see if we can come up with a draft ban, or we can write to the center and make an appeal, or maybe also make all the states come together and write to the center and probably exert more pressure in terms of banning these highly hazardous pesticides. Next slide. The other states which have also done something in terms of banning pesticides, for example, Andhra Pradesh and Telangana, again, southern states of India, have restricted herbicides. They have also come up with policies which are innovative in the way that they have stopped usage of pesticides in non-crop areas during months of December to May. And they have also cracked down hard on retailers to make sure that only recommended quantities of pesticides are sold. Again, the problem here is that because these states are all porous, I mean, Andhra Pradesh and Telangana are states which have been able to put forth these restrictions. However, the neighboring states haven't put these restrictions. And in India, all states, there is free movement between states, so farmers can still cross borders, or pesticides can be smuggled into these states. So the problem is that we need center action, and if that happens, we'll finally see some change. But right now, this is also a good step, and these steps are something which are important to exert pressure. So we have been helping states do that. Next slide. So this is the next question, and we can have a discussion on that.
Thank you. Thanks again, Asta, for taking us through the background for question 2. So the question 2 is, if there is government inaction in addressing HHPs in your country or other low and middle income countries that is allowing registration and sale of HHPs, then what alternatives can be considered? And we suggest you be specific. And who do you think is responsible for considering alternatives? So we'll have the discussion in the chat again, and then there will be some poll questions. See you in the chat.
So I see an interesting point in the chat by Debbie where she says that the country should be putting list of alternatives together with assistance of recognized specialists like universities. This, of course, I think is a very good point. And we have also reached out to certain agricultural universities in India who are working on this. And they work in small fields and they work with small farmer organizations and teach them how to do farming with alternatives or with less hazardous pesticides. These are not at the moment scaled up as much, but still, I think they are making good progress. Alternatives through integrated crop management through academia and farmers, and the buy-in from pesticide industry to move towards registering and importing lesser toxic alternatives. Yeah, definitely pesticide industries, if they are cognizant of what is happening and they join the fight, then it makes our work very, very easy. From my experience in Tamil Nadu government, where we worked on building a draft bill with them, they we had a stakeholder meeting with pesticide retailers and manufacturers, and we told them that sooner or later these pesticides will have to be phased out, so they should probably start moving towards biopesticides and try and make sure retailers are aware. So we have also retailer awareness programs where they do not sell if they feel that the person is not a farmer or the person looks under visible distress, or if it's a young person buying pesticides. However, these are again stopgap arrangements, I feel, because final banning is what will actually make a difference. Since most of the pesticides are imported, I suggest promotion of locally safe and friendly. Sorry, I lost that comment. Locally safe and friendly methods of IPM and biological control methods. Innovation to provide organic pesticides, self-awareness. Definitely organic pesticides at the moment do not have the same economies of scale that the other highly poisonous ones do. But if the demand drives up, then I'm sure the level of pricing can also match what currently is the highly hazardous pesticides, because right now biopesticides are much more expensive. So that's one challenge that needs to be tackled. Organization of dialogues and political pressure, such as workers, political organizations, political groups, groups of activists, and media. Yes, definitely. Civil society and organizations should take the initiative to do this. Public awareness, I feel, is one of the most important aspect if there is aspects if there's government in action. I see answers in the poll have come in. So South Africa, pesticide deaths and poisonings in the media, international regulation conventions, and published research data. Yes, definitely. I think uh, we need to publish more data on pesticide deaths that is happening. But again, we need to make sure we know specific compounds, because if we don't, then people can just brush it under the carpet or say that we can't ban pesticides. And again, CPSP always stresses on the fact that we are not asking for natural farming or organic farming or to move away from chemicals completely. But what we are saying is that highly hazardous pesticides should not have any place in the modern world and in modern agriculture, where we know that people are being harmed by it on such a large scale. Public outcry can motivate the government. A strong consumer movement, CSO movement, will influence the public and move government to action. Yeah, in Guyana, there is private advocacy on the suicide issue, and also international organizations such as PAHO has been working with local health ministry advocating ban on HHPs. Yes, private advocacy, I think, is very important. South Africa, NGOs, private independent research institutions, and public universities. yes, public universities, even I agree. I think they can really make a difference here, because governments tend to look for alternatives, and if public universities have already shown credible evidence, then they feel more confident in banning pesticides. In terms of agroecological practices, again, there is a requirement for the government to really push for these. Um, so I think the challenge here is that the government is not able to take direct action towards pesticides because of the strong pesticide lobby and the fear of unemployment or closing down of industries. But if the government decides to indirectly help the organic farming movement or natural farming, or promoting IPM and agroecological practices and biopesticides, and spread awareness, then at the supply level and the demand level, sorry, not at the but at the demand level, we'll be able to curb the usage of pesticides. So that is one way in which even governments can participate in reducing pesticide usage if they cannot go for open bans. Again, I think there are many points about sustained consumer awareness. So So in the chat, Debbie has said that ICGEB is working on a SADC website of biopesticides, which which I think is something which is very important. Most governments have the same question that they ask us: how to replace these pesticides and what to do about it. So I think it's something which is very powerful. If there is an all accessible list of biopesticides that all governments can access, that might make things very, very easy for policymakers to really ban pesticides. I'm sorry, I was muted. There was a comment saying biopesticide is a good option, but there should be stakeholder consultations. So I think that is very important. Community buy-ins are very important because we've seen in India that even if you ban pesticides and the community doesn't believe in not using pesticides, then there's no change really. And with such a massive population, governments really can't regulate it. So community buy-in is very, very important. Community movements have a lot of influence. Since we are a democratic country, politicians can actually listen to the people. Definitely. But for now, that's why consumer awareness is something we should focus on, because people are really not making this demand. And I feel the day this becomes something that governments feel is imperative for them to stay in power, then they will definitely take action.
Asta, would you like to give a summary to question 2 before we move on to question 3?
Yes. So I think generally when we look at government in action, for CPSP, I think what we did is we reached out to regional governments and local governments to make sure they are able to do it and they are able to ban pests, not even ban, but reduce usage or make sure there is safe usage, even though the center wasn't doing much. And we have found some amount of success there. At the same time, we have collaborated with other organizations which work on educating farmers. So, for example, let's say organic farming or natural farming, or working with farmer groups on in small districts to teach them how to not use pesticides. The problem is, of course, that scaling up of these issues is something that we really need to aim for, but at the same time we need to take these small wins as well, because these also help us create evidence for the government at a larger scale. So we are working towards working with as many stakeholders as possible in this. And we are aiming to work with the media and with consumer awareness portals in maybe in the near future. But for now, we have started looking at working in the media and reaching out to journalists to say if they could make a series on pesticide suicides in India, or they could work on the falling population of bees in India. And these could be very important news pieces which draw public attention. So that will be maybe something that we do next year or in the next 2 years. Thank you.
Thanks very much. So we will now move on to our last question and the background. Back to you. Thanks.
Thank you, everyone. I think there were some great responses. All responses were actually very good to the second question. Now we move on to the next part. So like I said, that we have been working with state governments and we're trying to find out how state governments can circumvent it. And I'll speak in detail about the Kerala organic farming policy that I had referred to in the earlier slide. So the policy that this state government did is that they made a completely chemical pesticide free zone, and they released a special state policy to ban the manufacturing and sale of red and yellow. Red and yellow is actually class 1 and class 2 in India. And the guidelines were then issued to restrict distribution and use of pesticides in Kerala. So they did a lot of innovative things, like saying that glyphosate, which is again a very poisonous herbicide, can only be used on barren land in Kerala. However, this is something which was very specific to the state because the state is very small and they do not have enough barren land. So actually, effectively, it just phased out glyphosate on its own. This is not very easily replicable to any other state in India. So we were not able to do that. But for Kerala itself, it was a good move that they did. The Kerala state also banned 14 pesticides. They were also dragged to the Supreme Court of India for banning these pesticides. And unfortunately, from 2011 to 2021, fortunately from 2011 to 2021, they were able to sustain the ban. But unfortunately, in Jan 2022, which is this year, the High Court finally said that the decision has to be given to the center, and they reverted to the center. So the bans were diluted. The problem was that Kerala was one of the stakeholders and one of the really flag bearers in pesticide policy in India. But I think there is a positive side to it, because the whole infrastructure in the state has been really amped up to make sure pesticides are not used. So this entire decade that they had of not using these highly hazardous pesticides made sure that farmers already know alternatives. The agricultural universities do spot testing. They have testing kits in a lot of markets to test vegetables for pesticides. And generally, the population is aware of the fact that Kerala has done something like that. So I feel that all is still not lost, and probably the center will also look at the fact that Kerala has done so well and ban these pesticides in the entire country. Next slide. So I also spoke about economic effects and how economies of scale is something which is very difficult to achieve when you move to different cost-effective alternatives. Sorry, not cost-effective, other biopesticides. And economic effects is something which is most important to consider, sadly, because in our interactions with the government, at many times, suicide or deaths of people is not something that is moving them as much as economics is moving them. And I know that it is something that ethically is not how things are supposed to be, but that's what makes the world go round. So we have to look at that. And we found that in 2018, over 16% of Indian farm exports were rejected by the European Union because they exceeded the maximum residue limits of pesticides. India also was one of the three countries with the most export rejections to the US. And India's exports, cardamom exports to the Middle East or Saudi Arabia, became they were on a standstill for 1 year because the nation tightened chemical residue norms in 2019. So I feel like all of these things also help in getting the 2020 draft ban come into place, because the government was under so much pressure due to farm residues and farm rejects. I spoke about Punjab in our last question discussion, where the state of Punjab bans pesticides for 3 months every year during sowing season. So they do that only because their basmati rice crop has been repeatedly rejected by EU and by the US, and that is one of their major revenue models. So they were able to do something like this, and they were able to pressurize their communities, and the communities actually were able to pressurize the state into doing something like that, farmer communities. Um, so we feel like if we have good export data, we'll be able to prove to the states that they are losing more money on exports than they are really earning from pesticide sales. Viability of transitions is another problem, because there is a misconception that if you stop using pesticides, either you will lose money, or if you move to other forms of farming, you will have to spend more money. This is again a myth, because if you reduce input costs, specifically if you move to natural farming or traditional farming, the input costs are reduced and you actually make more profits. And to transition into IPM, which is integrated pest management, or to transition into less hazardous pesticides, is not as cost it's very cost effective. There is no cost to the farmer at all. And if there are any costs, for example, let's say using a biopesticides, then I feel that the government should be able to do that, because if we are able to stop ourselves from export rejects, and we are able to earn revenue there, and we are able to make sure that food quality in India is considered to be good, then we'll be able to make that money, even if we give some sort of subsidies for biopesticides. So these are the kind of things that the government really needs to innovate and think on, and also agree that these things are very, very important. Next slide. So I feel that policies are effective only if we have some sort of government and community buy-in at the same time. And when we talk about pesticide policy change in India, with all the recent developments that have happened, I do feel I'm very positive about it. But at the same time, I know that it might be a long fight ahead, because I mentioned in the beginning that there are 66 pesticides under review, and at the moment only 18 have actually been phased out. So we have a long fight ahead of us, but I'm positive because the government has come up with many other agroecological approaches, and they are pushing for safe agriculture, chemical-free agriculture. So I feel if there is community buy-in there, then we'll be able to focus on those goals. Banning pesticides does align with the Sustainable Development Goals 2030. So reducing world hunger and reducing suicide mortality by 1/3 are SDGs which the United Nations has laid down. So India can achieve these sustainable food practices and resilient agricultural practices if we implement these bans. Also, it paves the way for banning additional harmful pesticides. So for now, like I said, only 18 have been banned, and 27 are under the scanner, but we still have 30 more to really ban. So if we are able to go ahead with this ban, we'll be able to go ahead and start looking at other pesticides such as paraquat and aluminum phosphide, which are now coming up as major suicide modes in India. Also, this aligns with India's developmental goals and state schemes which focus on sustainable forms of agriculture, uh, community buy-in, because we have tribal communities, we have rural communities which have their own indigenous relations with the land. So land is very sacred in India. Land is very sacred for them when they grow food on that land. And it is very important to promote indigenous forms of agriculture, which has been passed on generationally and not only depend on pesticides completely. At the same time, it is our responsibility to the food, to the soil, and to our environment, and also to non-target species such as falling population of bees and earthworms, which has happened because of these highly hazardous pesticides. So I think we are morally obligated to make sure that we focus on more agroecological approaches. At the same time, it is also a human rights issue where developing countries are facing the brunt of these pesticides that are manufactured abroad. And if I would again like to reiterate that if other countries such as the EU or the US find this food unfit for consumption and reject our exports, then it should not be okay for our citizens or people within India to be consuming this food, because this export reject food comes back into our supply chain. So we should be looking at all these topics. I think next slide.
Thank you. Thanks very much, Asta, for giving us, some possibilities of how to move forward and what countries could work on, what some of the different possibilities are. So we've looked at barriers, we've looked at inaction, and now we move to the third question, which is what is needed to actually mobilize effective pesticide policy action in low and middle income countries, so in your countries, many of you, to address pesticide suicides. So we'll discuss this in the chat, and we will have a couple more poll questions. See you in the chat. Thanks. So while you're commenting on the third question, we also have posted a poll, what makes a pesticide policy successful? And you can respond to this by clicking on the link in the chat. in the interest of time, we'll move on to the next poll shortly. So I don't know if anyone wants to do any final posting, and Asta, if you would like to comment on it.
Yeah. Yeah, I see all the responses are, of course, about implementation and enforcement and consumer awareness. These are good responses, and I'll just give my summary. I feel that a successful pesticide policy is one where we consider all stakeholders, because there are also small businesses which are manufacturing businesses of pesticides in India. So we need to make sure that these businesses survive the transition to biopesticides, or manufacturing lesser hazardous pesticides. Traders and retailers who sell pesticides need to be taken into confidence, so that they understand that these pesticides are very harmful and they should not be selling those. At the same time, farmers and consumers need to understand the importance of it, because community buy-in has to be our major goal. And at the same time, monitoring is very, very important. That's what makes a policy successful, because if we do not know, we are not collecting enough data on what kind of pesticides are being used or what specific compounds are leading to deaths, then we again are not able to make any changes in our monitoring systems or in our implementation systems. So I think it's very, very important to make sure that policy is successful by considering all stakeholders.
So we have our final poll for today. What are the major challenges to implementation of pesticide policy? And you should be able to vote for more than one. Sorry, I see you can only vote for one. So what is the major challenge should be the question. In your opinion, what do you think is the major challenge? And I see some of you have posted your own, like private-public partnership.
By I think there's a question, when you say communities, does that mean general public or farmers? For me, I think it means the communities at risk. So this could be farmer communities and rural communities which have easy access to pesticides. So, for example, children and young people and women have very easy access to pesticides, and that leads to a rising number of self-poisoning suicides.
Asta, do you want to make any comments on what you've seen in the chat before commenting on the poll?
Okay. I don't think I have any comments on the chat earlier. I'll just speak about the poll. Was the community's point clear?
Yeah, my feeling was when it says lack of buy-in from communities and you made the comment about, children and women, I'm not sure how children and women could have women maybe, but children have the buy-in. So I was just wanted to see if the reference was correct.
So I meant that since children are at risk, I felt like communities in general would make sure that they look at that also as a problem. So in general, rural communities which are at risk should understand that they need to ban pesticides. That was my viewpoint on that.
Thanks. So if you want to comment on anything else on the poll, that'll be fine before we, in a few minutes, start winding up.
Yeah, I think I agree with the poll as well. Here, it's many people have picked lack of buying from communities as their major challenge, and though that is, for me, actually, it's bureaucratic will, because I have faced that in the policy space in India, because if there is no change in policy, then there is nothing to really buy into. So that is one aspect. But of course, community buying is maybe a close second for me. And I feel bureaucratic will can be created if the problem can be presented to them when there is already existing research evidence that can be shown to them, and specific local level research can actually be shown to bureaucrats, and that actually makes a lot of difference. Buy-in from communities is again important because they are the ones who will be bearing the brunt of the policy change. And fear and mistrust in policy makers is a challenge, because sometimes there have been laws that have been passed without much thinking, and that has led to different effects than was intended. And therefore people in general feel that if there's any sort of change, specifically in terms of pesticides, because farmers will have to spend more money to buy biopesticides, or initially they might feel a hit, and if there's not enough communication, there is definitely that fear and mistrust that continues to remain. uh, and lobbying my manufacturers is again a major challenge. I think I would place that at the same level as bureaucratic will, because we feel that manufacturers in India have immense financial power, and they are able to influence decisions according to them. So we need to make sure there is more consumer awareness and there is more bureaucratic will to counter that kind of influence.
Thank you. That's an important note to end on. And firstly, I'd like to say thank you very much, Asta, for taking the time to put together such an important presentation with so much detail, and the discussion that you have led us through. It's been very obvious from the discussion of our over 55 participants that there's been a lot of debate and discussion and thought about the topic. And I really hope that participants will take away some lessons, not only in terms of what their country can do and what can be done at the policy level, but also what each of you as an individual can do to play a role in the prevention of pesticide suicides. So we have a poll evaluating the discussion that you should be seeing on the screen, and we ask if you could please fill that in. I'd also like to thank Tatum and Naomi in the background for the technical support, and also to thank all of you who took time to give of your expertise, your ideas, and your thoughts. And please do sign up for the Pesticide Discussion Forum if you haven't signed up as a member, so that you receive the digest. There will be a summary of this discussion, The links that were referred to, articles that were referred to, will be in the discussion digest that comes out. So please make sure that you've signed up. Also, you can sign up for the WhatsApp group. There is a link to sign up for it if you want to receive advice in the future or comments in the future about further discussions. So our next discussion will be on the 3rd of November, where we'll be looking at the relationship between pesticides and different pollinators. So please do make sure you've signed up and registered. But I thank you all again for your time, and thank you very much to our presenter, and I wish you all a good day and stay safe. Thanks a lot.
Thank you so much.
Thank you. Bye.